Welcome back. You're watching The House of Wellness. For the past 3 weeks, we've been investigating differences between a chiropractor, a physiotherapist and an osteopath, Joe. Not an easy thing to do. So to wrap it all up, we brought in all three to join us on the couch. Welcome physio Joanne Raitt, Michelle Funder, the osteo, and the chiropractor Michael Bloom. Thanks for joining us, guys.
Thanks for having us.
Now, let me start. I want to ask a bit of an insight in a nutshell. Can you give me a quick one-liner of what the differences are? I might start with you, Michelle. What sets osteos apart?
Osteopaths, generally, we look at the body in a more holistic fashion. So when you come in to see an osteopath and you have something like low back pain, we'll be looking at not only the lower back, the hips, the knees, the ankles. We'll be treating other areas of the body, not just the area of the symptom, to make sure that we're really getting down to the root of the cause with osteopathy.
OK, Joe, physio can step in now. What sets you apart?
Physios are trained in hospitals, so we have quite a medical focus to our assessment and management of patients, especially lower back pain patients in this case, and we try to use evidence-based medicine, research-informed choices in our decision-making in how to best manage patients.
Now, do we have to be careful here because historically the chiros and the physios were at war with each other. Michael, you didn't put the two in one room together. Is that an urban myth or what sets the chiros apart?
I'm glad you put me on a separate seat. Look, I think it's a bit of an urban myth. There'll be a small percentage within each profession that, you know, have an axe to grind about the other professions, but I think in general I think it's beat up a little bit that, and we tend to get along better than maybe the public may have been led to believe. I think we get along fine.
So what about the chiros? What sets you apart from the physio and the osteo disciplines?
Well, chiropractic is traditionally always been about the relationship between structure and function, and by that particularly the structure of the spine and then therefore its effect on the function of the whole body. That's from the inception of chiropractic. But I guess in a similar vein to the physiotherapy and the osteopathy, we're evidence-based and we have progressed with the times, and we look at factors which lead to people, going down that road of perhaps their health's not as great as it should be, and bringing our skill set into helping them recover.
When I think about chiro, I know you as people that crack backs. Is that the difference, that you spend more time on the spine rather than the rest of the body?
We do. We are known for that. Absolutely. We do spend time in our education, and we do spend time in our practice dealing with the other joints of the body. Traditionally, that cracking style that you just described is what we've been known for. However, look, there's a lot of diversity even within our profession. There are chiropractors that they would do none of that cracking type adjustment, and then there are many others that will. But traditionally, we've always been known for that high speed, low force thrust into the spine.
Hey, Michelle, in your profile last week, which was fantastic, by the way, you mentioned that you assess the whole body more than just the area causing the pain. What other factors are you looking at?
We're looking at the whole body, so a biopsychosocial model. So when we take a history, we're talking to people about, how much they sleep, their stress levels, what they're eating, so that we get a real idea of what their whole body is, going through and how that relates to their physical injury. So, you might be coming in for head, neck and shoulder pain, but they may be a very stressed person. There might be lots of other things going on. So really stepping back and looking at the whole body, and then not only just treating the head, neck and shoulders, but the diaphragm, which is a big muscular dome under the rib cage, has a lot of links to the neck nervous system, to stress, and so we'd be treating those areas. So sometimes clients sort of think, oh, I'm in here for my neck and shoulders, but I'm getting my ribs, treated. So it's a really lovely way of looking at the whole person and not just the area of symptoms.
So, Joe, for a physio, is there a type of patient or a certain condition you say, hey, this is the sweet spot for physio? Stay away from Michelle, stay away from Michael. You can only come and see me for one particular type of ailment?
I wouldn't say that. I think we probably all have a place in managing similar conditions, but I think the fact that as a physio we can work on field with sporting teams, we can see patients with back pain in an ED situation. We can see them in conjunction with doctors in hospitals trying to determine if they need surgery, or see them possibly in rehabilitation hospitals doing exercise therapy afterwards. So I feel that physios just can see them throughout the whole journey of the back pain cycle.
Now, I must confess that I do see an osteo and I see a physio and I have seen a chiro in the past. Is it okay, do you think, Michael, for me to see 2 or 3 different disciplines at once?
Yeah, absolutely. Absolutely. That commonly happens. There are people that are seeing me that are seeing an osteopath in the same week. In fact, it's happening this week. There are people that see me that see a physio, so I have absolutely no issue. We can't all be fantastic at everything. We have our skill sets, so we need to help someone manage themselves to get the best outcome for themselves, and that may be seeing a mixture of people.
This is like reality TV now, Joe. You've got to choose a practitioner. Where are you going?
Oh, look, all I know is when you talk about time on the table, I just imagine the noises that come from me when I am being manipulated and treated. I mean, you're all very talented people, but geez, sometimes you go, is this supposed to feel good? I don't know. But you come away feeling great.
Thanks to everyone again for taking part in our Back to Basics special and bringing us a heap of relief in knowing what to call on if we do get into trouble with some back pain or many other ailments. Still to come in Men's Mental Health Week, the guru himself, Gus Worland, joins us up next right here on the House of Wellness.